Hello and welcome to Healthwire Media. I'm Sneha Kumari with you, and you're watching our very exclusive interactive session. Today, we are going to talk about again a very important topic that I think सभी लोगों को जानना चाहिए, या फिर आपके बॉडी के साथ क्या ऐसे चेंजेस हो रहे हैं या क्या ऐसे सिम्टम्स आप देख सकते हैं या देखना जरूरी है हम लोगों के लिए। उस टॉपिक पर हम बात करने वाले हैं, जो कि है द प्रेवलेंस ऑफ प्रीमेच्योर ओवेरियन फेलियर अमंग यंगस्टर्स। सो व्हाट इज दिस एंड क्या ऐसी सिम्टम्स एंड साइंस हम देख सकते हैं और क्या हम यंगस्टर्स को इसके बारे में जानना चाहिए। ये बहुत ही इंपॉर्टेंट टॉपिक है, जिसके लिए हमारे साथ जुड़ चुकी है डॉक्टर समीना, who is a consultant gynecologist at Manipal Hospitals. We welcome you, ma'am, on Healthwire, and thank you for joining us. We'll like to know, first of all, from you is that what is premature ovarian failure? What do we know about this? और क्या है इसका मतलब, अगर आप हमें थोड़ा जिस्ट में बता पाए।
See, premature ovarian failure, or it can be called as a primary ovarian insufficiency. So basically, this is where the ovaries, they stop functioning much before the age of 40. Okay? Or it can be sometimes seen in an early age also, maybe during the teenage also. See, naturally what happens is, for a normal woman, the fertility, as she is approaching the age of 40, the fertility starts decreasing, and then there is a slow transition towards menopause. But in primary ovarian failure or ovarian insufficiency, the number of the oocytes, or you can call it as eggs, they don't either function normally or they get exhausted in a much premature age. So this is basically a premature ovarian failure. For that instance, now if you consider for any normal girl who attains the age of puberty, in her ovaries there are around nearing around 4 lakhs of immature eggs, which will be stocked in her ovaries, and that she can use it up throughout her lifetime. So throughout her lifetime, she may need maximum 400 to 500 eggs. And even at the rate, and these 400 to 500 eggs, they help her to have regular menses, and even one egg is used for each pregnancy. So you can understand what exactly happens there. But in a premature ovarian failure, these eggs either they don't function properly or they are exhausted at an early age. So this is how it is. This is what is called as a premature or a primary ovarian failure or an insufficiency.
Okay. And what can be the causes or risk factors or the prevalence that we are seeing in the current time?
Okay. Now the cause as such, we cannot pinpoint the specific point as like, this could be the cause for a primary ovarian failure. But having said that, there are many risk factors for it. Now the risk factors, let me segregate it as like, which are not in our hands. Like it can be sometimes a genetic factor also. There is a condition called as some chromosomal abnormality will be the reason for it, such as Turner syndrome. And then some metabolic diseases. The metabolic diseases where there is increased galactose levels in your blood circulation, that's called galactosemia, where these increased galactose levels can destroy the normal ovarian tissue. And sometimes it can be an autoimmune condition also. In an autoimmune condition, what happens is, generally the antibodies, they target either the bacteria or the virus, basically the harmful substances. But in an autoimmune condition, your own body will develop antibodies against your own tissues, normal tissues. So they start targeting your ovaries. So usually, like it can be either in thyroiditis, autoimmune thyroiditis, or it can be a rheumatoid factor, or it can be an anti-nuclear antibody. So any of these conditions. Then coming to there can be other contributory, like environmental factors, such as environmental toxins. It could be some chemicals or fertilizers which are used nowadays, and smoking, for that matter, smoking and excessive alcohol intake, and even following, like, in malignancy patients where they would have undergone chemotherapy, radiotherapy. So in chemotherapy and radiotherapy, what happens is, usually that's used to destroy the cancer cells. But it so happens that they can even target the healthy normal ovarian tissues also. So these may be the risk factors. And if at all, if there is somebody in your family, like maybe your mom or maybe your sister, who would have had a premature, like, premature menopause or something like that, then that could be one of the risk factor for it.
And if we talk about the signs and symptoms of this, how do you explain the signs and symptoms of this? Or what are the signs and symptoms we should look for?
Okay. See, usually what happens is the patient, the person with the primary ovarian failure, the most important symptom,
Yeah.
she will be missed periods. See,
Okay.
usually a normal human being, a normal female patient, female person as such, will have maybe around 9 to 12 periods per year. But these people with primary ovarian failure, they can be less than 9 per year, or sometimes they may not have periods at all. So that is the most important symptom. Now, what happens in this primary ovarian failure is because of the hormonal imbalance. Now, there is usually there are two main hormones which act in the body of a female, that is estrogen and progesterone. So, when this balance is not maintained, what happens is there's a imbalance of the hormones, and because of which the estrogen starts depleting, and they can have menopausal symptoms like such as hot flushes, night sweats, irritability, and they can have decreased sexual drive, or they can have vaginal dryness, and this in turn can lead to infertility. That could be one of their main symptom, that difficulty to conceive. And then they in turn, now as I told you before, there will be decreased estrogen levels, a hormonal imbalance. Usually for a woman, in a woman's body, these hormones, the female hormones, they protect a woman from estrogen is supposed to be, the estrogen hormone is supposed to protect a woman against any heart issues, cardiac issues. It even gives her protection against any bone issues like maybe osteoporosis and all these things. So sometimes what happens is when there is a primary ovarian failure, they can have other associated symptoms. Maybe they have this anxiety and depression, and because of the too much of dryness in the eyes, and they can have other associated thyroid issues, or they can have some cardiac issues also, and they can have an early onset of bone pains and bone issues, basically osteoporosis. And then finally, they will be having issues with, as I told you, infertility, difficulty to conceive.
And what is the diagnosis of this, or if we see the treatment options for this, what are the treatment options available for us?
Okay. See, usually when a patient comes to us suspecting, when we are suspecting primary ovarian failure, basically we concentrate on the history. So is there any history? As I told you, whether her mother or her sister is having the same issue. And then we concentrate about, we also ask about her previous medical history, whether she had any history of malignancy as such. It could be either chemotherapy or radiotherapy, following which she could have had this issue. And then we do a detailed examination, a physical examination, a pelvic and an internal examination. And then we decide whether the patient has to be subjected for the hormonal profile. So in the hormonal profile, we do check for the whether all the hormones are in balance, we check for the ratios, and then we ask for the scan. In the scan, basically we look at the structure of the ovaries, and we also look at the structure of the uterus, because the uterus structure will be responding to the hormonal actions of what is produced by the ovaries. And then when we are suspecting, it is a much earlier age and we are suspecting some genetic component, then we do get a blood test, that is chromosome analysis, where actually the chromosome is that part of the cell which carries the genetic information. So we subject the patient for the chromosome analysis, and we rule out if there is any genetic cause for this primary ovarian failure.
Okay. And what are the chances after the treatment? What are the chances for pregnancy or fertility improvement after the treatment?
See, when you are talking about primary ovarian failure, it can be one of the main reasons for infertility also. In such patients where they come to us with the main concerns of infertility, anxious to conceive, we do give them supportive treatment. We have to give them that extra assisted treatment for them to conceive. There are chances that they can conceive on their own. There have been some cases, but in some cases we may have to give them some medicine so that the ovaries start functioning and they start ovulating. So it can be, that is called as ovulation induction. So in ovulation induction, we can give them either oral medicines, and then we may, if at all, if it doesn't work for them, we may have to step up to, we have to add injections for that. If still it doesn't step up, if it's still not sufficient, it's not working, then we step up. We go to higher infertility modalities of treatment. It can be an IVF treatment, or it can be a donor oocyte. So there are different modalities of infertility treatment when it comes to primary ovarian failure.
Okay. And ma'am, the last question I want to take from you is that what are the preventive measures that we can take before, to avoid this, or to, to take care of ourselves?
Okay. See, when it comes to the preventive, it can be like, sometimes it can be unknown, but there is one definitely, like, if at all, if it is a genetic cause. Now, if, for example, if somebody is having this genetic component in them, they have this high risk of developing or going towards primary ovarian failure. But for them to go towards primary ovarian failure, there will be some contribution from the environmental factors.
Yeah.
So having said that, that component can be controlled by us. Like it is always, yes, the key point will be lifestyle modification. When I talk about lifestyle modification, it's not just lifestyle. There are many, it's a multidisciplinary approach towards your lifestyle modification. Yes, the most important component is, healthy eating habits, healthy dietary pattern, where your diet we should make sure that your diet is, rich in dietary fiber, and it should be free from this trans fat components, like, trans fat content as such, which you find, I think most of the time nowadays, you find this component is, it dominates most of our food items, the trans fat content, and, go for good amount of protein, and go low on salt and sugars, and then have good amount of complex carbohydrates in your, the good carbohydrate in your diet. So this is about your dietary component. And then coming to your, you make sure that you incorporate at least 30 minutes of exercise in your routine. So 30 minutes per day, or maybe at least 3 days a week. If at all you want to have a better benefit from it, you can go for 45-minute session, maybe 5 days a week. So all these, when you do this modification, when you have this active lifestyle, there's good circulation, the circulation in your body improves, the hormonal imbalances are all, they get settled down, and your chances of, like, going towards, if you're having certain risk factor, which is not in your hands, it could be a genetic component, or there's some family history, at least your rate of progression towards the disease can be, decreased, it can be minimalized. At the same time, try to cut down on your stress factor also. So the stress factor, what happens is, when there's too much of stress in your body, there's increased stress hormones. So these stress hormones also will have a very adverse effect on your ovaries and the future functioning of the ovaries. And then have a good sleep pattern. So what happens is, there is something called as a circadian rhythm in our body. When there is something which is set as day and night. So when this gets altered, it could be due to any reason. Nowadays, there is this late working hours, and I think most of them, they sleep late because they spend so much of time watching on the social media, and so make sure that your sleep is not disturbed. So the circadian rhythm, when it is not disturbed, the hormonal balances will be better. Yeah, it will be maintained better.
Okay.
So these are the contributory factors which can, we can try to modify on the disease progression.
Correct. Okay, so I think we got a lot of insights from Dr. Sameena, and try to follow these and make some changes in your lifestyle to be healthy and to avoid these problems. So, and for more such topics, you can follow us for our, interactive sessions, and keep watching us. Thank you so much, ma'am, for joining Healthwire and giving us your insights to us. Thank you so much.
Thank you.